With the arrival of fall, doctors across the country are now reminding Canadians about taking precautions against viruses like COVID-19. This is the number of confirmed cases in the country is on the rise, prompting a renewed call for vaccinations. With more, I want to bring in CTV's medical expert, Dr. Marla Shapiro, this morning. Good morning to you, Dr. Marla. So what are we learning right now about COVID-19?
So this is the time of year where we typically see an uptick and an upsweep. And COVID really has become endemic. It's part of the fall respiratory viruses that we see. We see it pretty much circulating all year round, but then it takes a lull in the summer. So we look at our August months and we see what is coming into hospital and what is being positive cases that are in hospital. Now, remember, overall, we're seeing less in hospital because it tends to be more mild than it was when it originally hit the scene. So we're seeing right now positivity is about 8.5% or so in terms of what is presenting itself to hospitals. If we look at what happened last year and the year before, certainly it was higher than it is now, but it's that typical uptick that we see. And if we look at, where it is happening, so you can see that August 24 was about 17%. We're somewhere in between, but it's probably underestimating because people are just not making themselves present in hospital because they're not that sick and nobody is doing home testing anymore. So we have all these cases that are influenza-like that are going undiagnosed. If we look at wastewater testing, which is how we do this now, so we accumulate what's happening in the wastewater, we see that overall across the country, definitely moderate activity, but hotbeds, if you're in Vancouver, Calgary, Edmonton, Winnipeg, Montreal, PEI, you're getting more of that late summer increase, and we know that behind a late summer increase is the fall-winter surge.
Do we know what's behind the uptick in cases?
Typically, it's the fact that now we're getting to see kids in classes, congregating. Right now across the country, we've got a lovely week that's happening, but fall weather is happening. When fall weather happens, we get the uptick in all viral illnesses, and we're crowding, and we can spread it close to close. We know that in closed areas, you're likely to see more viral illness.
So we kind of know where things are going.
We know where things are going, and, it brings us back to the lessons that we've learned, and the lessons that we've learned are think about vaccines. Certainly, if you're over the age of 65, if you're over the age of 80, those are the ones. You're going to be higher risk if you've had no recent vaccinations, long-term care. But you know what? Absenteeism is a good thing. If you are sick, don't come to work. Don't come to school. That's one of the best ways to break that chain of transmission.
Okay, so what lessons then do you think we have learned? Is it about the vaccination when we look at where we've been to where we are now?
I think it really is. When patients say, oh, you know how many COVID vaccines I've had? I say, well, how many flu shots have you had? This is about protecting seasonal flu illnesses, and we know that COVID, like flu, changes its variant nature. We're still seeing strains that are coming off that original Omicron, but they're different than the strains we've had before. So we need a new vaccine for the subvariant XFG that we see. It's causing mild to moderate illnesses, but if you're over the age of 65, particularly if you're over the age of 80, if you live in long-term care, if you're immunosuppressed, if you have other comorbid illnesses like chronic heart, chronic lung, you are the should have, must have, and the rest is have a conversation to see, look, if I have the vaccine and I don't spread it to anybody around me or older individuals, you're doing something not only good for yourself, but societal benefits. So again, new vaccine on the horizon, been approved in Canada, likely to come to a pharmacy or your physician's office within a month or so. Have the conversation, should I get vaccinated?
Okay, we're at that time of year. Next week, flu shots. Okay, Dr. Marla, thank you so much. As always, great to see you. Marla Shapiro, Dr. Marla Shapiro is our CTV medical expert.